Hello, it's Dr. Pat Ricalde. I'm live Facebook in my backyard, and so I apologize in advance for any noises you might hear. It looks like I've got a good internet signal, so hopefully this will go smooth. Just wanted to reach out to everyone. I've had a lot of people ask me questions, emailing me, calling me, and I thought that this would be a great way to connect with people to talk about the COVID-19 virus. And I've done a lot of research, and I'm welcome questions if you want to. I think you can submit via the Facebook Live app, and I'll try to answer them as I go along. So essentially, the COVID-19 is a virus similar to other viruses that perhaps you're familiar with, but it is absolutely not the same as anything we've ever seen before. It's considered a novel virus because humans have never seen it before, and so there's no immunity on the planet. It began in China in the Wuhan district and spread very, very quickly. So there's a lot that we really just don't know about it. So let's talk about that for a few minutes. The virus, as many of you already know, was thought to originate from the food district that quickly became a source of spread through humans. And then people take to their homes, they interact, and they share and spread. And one of the questions that I hear a lot is, how are people catching it? How come it's so contagious? And is it similar to the flu? Well, in our best guesstimates, it's about 3 times as contagious as the flu. And if you think about that, the flu, we're talking 20 to 40 million people catch annually. So if it's three times as contagious and we do nothing, we're looking at some pretty significant numbers of people that can get this virus. Why is it spread so quickly and so much more than the flu virus? Well, we don't know for sure. There's been some initial testing, and in an experimental lab model, it's definitely spread via respiratory droplets, which most viruses are. In other words, you sneeze on someone, you cough on someone, and the little droplets that project and land on that person is where the virus spreads. What's more worrisome for this, though, is that it may actually also survive airborne. What does that mean? Well, if we take and aerosolize the virus, like we do, for example, oftentimes in dental offices or in surgery, where you have a drill and it splashes and that virus is suspended in the air, it can actually live in that environment for theoretically over 3 hours. At least it has done that in a research setting. So if I'm a surgeon and I drill and I create this aerosolized virus, and then I leave the room, the next person who walks into that area can catch it theoretically. So that's one of the big concerns with this virus. The other thing about this virus is that there have been some studies that have shown that it can be in stools or feces. Again, don't know a lot about that, but the suspicion is that it can be. So you really need to be careful, especially if you're helping your elderly parents or children, or of course in a healthcare setting. So that's the virus, and that's why we should be taking it seriously, because it seems to be a lot more contagious than anything we know right now. And it also is very easy to contact and spread and move on. Now, the other interesting thing about this virus is in people who are positive, who are known positives, there's been some research to suggest that 87% are asymptomatic. In other words, they don't even really have any symptoms. They don't have cough, they don't have runny nose. So they're going about their normal lives and can be contagious. So they can be carriers to spread this infection. Now, of that cohort of those people who are asymptomatic, a lot of them are going to go on and perhaps they're going to get some cold symptoms and perhaps they're going to just get better, and it's never even going to alert them to go and see a doctor or whatnot. But again, according to what little we know right now, just looking at countries that have already been affected, people who end up being hospitalized, about 40% of those hospitalized with COVID are actually between the ages of 20 and 50. Let that sink in for a minute. So young, healthy people may have mild symptoms, but of those people, they can still require hospitalization for management of their problems. So maybe they'll have asthma flares, maybe they need some nebulizers, maybe they need some medications or IV fluids, maybe they have diarrhea, whatever other things, they're gonna go to a hospital for treatment. Now, as the virus numbers continue to increase, that number of people who are going to be in a hospital setting can very quickly overwhelm a hospital system. And the hospital's just not ready for that. And we know that because of what's happened primarily in China and then, of course, in Italy. Italy, according to the trends in the growth of the virus, is about 9 days ahead of us in terms of the numbers of cases. So if you look where Italy is, we're about 9 days behind. So we really need to be prepared and mobilized. Not panic, not scared, but prepare. And how can we do that? I want to talk a little bit about preparation as well. But let me just take that concept, that thought, one step further. This is much more serious for elderly people, because those who have immunocompromised or other medical conditions, if they get the virus, they are much more likely to succumb to the virus or develop severe respiratory issues, ventilator, and may even pass away because of the severity of the disease. So all of us, as a public health standpoint, we should be frightened about that. We should be really trying hard to protect our population and our loved ones from getting that. And so if we stay healthy and stay out of the hospital, then we can make room in those hospitals for the people who are really going to need it, because we really need to focus those efforts on the older population. So as far as what to do, how to prevent, how to contain, how to manage the situation, I think being logical and staying clear-headed is really important. But we need to be smart. We need to be on top of it. I think that acting reactionary is never as smart as being proactive on how to manage this. So if you have cold symptoms, if you think that you are ill, self-quarantine. I started to get a sore throat. My daughter had a fever. We're self-quarantining. I'm practicing what I preach, okay? And even though it's mild, I don't want to take a chance of spreading this to other people that can then take it home to their families, okay? So do the same. Stay home. Don't go to public places. If you have to go out, limit those interactions. Keep track of what you need, and maybe instead of going out every day to get one little thing, maybe once a week designate one person in your household to be the one to go out and get the things that you need, and try to get things if you can so that your supplies are full. You can stay home and not go out and risk contamination. What kinds of things can you prepare? Well, obviously food items. Make sure you're stocked up so that you don't have to go out. You're not going to be able to go. You shouldn't be going out to restaurants, bars, beaches, public, anywhere. Get arts and crafts for the kids. Obviously, anything to help keep your mind active so that you don't get too crazed at home. I'm learning that myself, is going to be important. The other thing is medications. If you're taking any medicines, order 3-month supplies. Most of the pharmacies will do mail delivery. You can do drive-through delivery at pharmacies, but really try to avoid going into stores. If you absolutely need to go to a store, take tissue or paper towels, anything that's public contact. Use a tissue or a barrier. Use that paper towel to open the door, go in, do your thing. come back, and then throw that away. If you have a mask, wear a mask. I hate the thought of people going out and buying a bunch of masks so that they're not available for healthcare providers. But if you have that stuff, if you have anything to wear across your face, absolutely. How do you know if someone's going to sneeze in front of you? Why not protect yourself? The CDC is telling healthcare providers, if you don't have a mask, wear a bandana. I mean, it seems silly, but right now, as much as is unknown and as contagious as this virus is, why not? So protect yourselves, wear masks, and washing your hands it works. So you don't have to necessarily wear gloves if you're going to go grocery shopping, but go grocery shopping, get what you need, come back, don't touch your face and rub it. As soon as you finish, wash your hands or use that hand sanitizer, and then bring yourself home. Now, one of the things that we've done in my household is we actually have developed sort of zones of decontamination when we have to go out and come back into the house. Even going to check the mail or going to get Amazon packages. My zone 1 is my outside gate. I have a gate. Nobody's allowed to cross that gate. I actually have it hard locked so that I can't get somebody just randomly stopping by that I wasn't expecting. The pool guy, a friend, whatever. So lock an outside perimeter. They knock on the door. If it's Amazon, I just say, hey, just leave the box, thank you very much, and leave. There's no need to come face to face. Even FedEx the other day stopped by and wanted me to sign for a package. I said, hey, this is COVID. We don't need to be signing for packages. He said, you know what, you're right. I'll just leave it here. I just want to make sure that you're aware so nobody steals your package. Thank you. People are very understanding. So leave the package at the door. I go out. I take the packages. I bring them inside the gate. So that's my zone 2. I set them down. If they're covered in cardboard, the virus can sit on cardboard for 24 hours. So if that FedEx guy or Amazon guy sneezed on my package, that virus can be on that box for 24 hours. So I'm going to just leave that box sitting in my courtyard in the shade for 24 hours, and I'm not going to go near it. I'm just going to leave it there. After 24 hours, I'll go and get that box and bring it in, and now it's safe. Plastics, 3 days, the virus can stay on plastics. So instead of, so you can wipe it down. If you have a disinfectant or soap and water or, sprays that are virucidal, read the bottle. It'll tell you if it kills viruses. And most of them do, believe it or not. So you can spray them down, wipe them down, then you can bring the package in. But if it's something that has a lot of crevices or cracks or like Publix, like plastic bags, I'm not really sure how to clean those well. I just leave them for 3 days, and after 3 days, then I bring them in, okay? So cardboard boxes, 24 hours, plastic, 3 days, unless you can wipe things down. And then I bring them in, and at that point, I consider them safe. And again, am I being overkill? Well, why not? May as well take the extra precaution and be safe. So, and then the third, so my zone 1 is outside, my zone 2 is just inside the fence, and then the zone 3, the last thing I do before I can actually enter my house, I have a hand wash station. So I never forget. Soap, water, I have the hose, because I do all this in my courtyard. I do the hose and I rinse my hands off, and then I dry them, and then I walk in the house. That way I can preserve my hand sanitizer too, and my sprays, because I think those are probably going to run out. Clothing.
What we've been doing with clothing.
That's my husband's here reminding me. So the other thing I've done is when I've sent my husband out to actually go to the stores, he'll go out, go to the stores, do whatever. He does the same 3 zones, but before I let him interact with the kids, all the clothing gets washed. He actually goes in and showers, and then he is interacting with the children. The other thing I forgot to mention earlier is that the virus, according to the China data, is carried in eyebrows, eyelashes, and can get in through the mucosa, the eye tissues. So goggles, sunglasses, masks are important. So that's another thing I forgot to mention is a mask alone, if you don't wear goggles, is not going to be enough. You need a mask and goggles or a face shield if you have somebody sneeze on you. My dentist friends, I have to give you a big shout out. I know that dentists have been asked to stop elective procedures, but you're still doing emergency procedures. Please be careful. You really need to be full on PPE. We're talking hair, goggle, mask, the full hazmat, everything, and be super, super careful. Ideally, reusable so you can wash and re-wear things is the way to go. The other thing that we're doing, if you happen to have an N95, which most of my medical friends have like one or maybe two of them, those are gold. Do not throw those away. We put the N95 on, and you can use a regular surgical mask or even a bandana on top of that, something on top of the N95 to protect it. It's because you don't want your N95 to get splashed with blood or bodily fluids. So you protect your N95, and then whatever you have on the outside of the N95, you can wash, you can throw out, you can whatever exchange, but your N95 becomes your lifeline. Now, if you don't have an N95, there's a lot of ways that you can actually get on YouTube or Google, but you can modify regular masks. Well, the easiest is just double stick tape all around a surgical mask to at least give you a seal, and then of course you wear another one on top of that. Minimum, an N95 is better, but at least it's better than nothing. So those are some things. Let me just look at my notes.
You going to talk about the statistics at all? The numbers in Florida?
Great point. Yeah, let's do that. So why am I so concerned? Well, we should all be concerned. I've been following the numbers and trying to keep track of some of the growth rates, and we're very much following the growth rates of Italy. We started seeing cases, we started tracking them on March the 11th. We had total number of cases in the United States, 1,000. In the Florida, we had 16 and 0 deaths. On March the 20th, we now have 432 confirmed cases in Florida and 9 deaths. Let's talk about this for a minute. A lot of people are asking me about mortality. What is mortality? You know, you don't know mortality rates until people die, okay? So it's very difficult, and a lot of people are not completely believing all the Chinese data. So, you know, I think that we're still sort of in the phase of uncertainty for mortality. But here's my take on mortality. The mortality has been quoted at around 2%, which is higher than the flu. But a paper that came out in the Lancet, which is a very prestigious medical journal, came up with a very, very good point. The mortality rates that they're looking at the number of deaths that occur today and dividing it by the incident rate of cases today. That's not good because we've already exponentially increased. So somebody brought up the point, and I won't take credit, but I will use it, that the appropriate way to document mortality is by estimating the mortality rates by dividing the deaths on any given day by the number of confirmed COVID cases from 14 days prior. If you do that, the China numbers, the mortality rates go from the 2% that was quoted, they go from that to 6 to 18%. Significant. Now let's just look for a minute at Florida numbers. And again, we haven't had 14 days of the virus, so these numbers are only looking at 9-day data. But the number of deaths today is 9. The number of cases 9 days ago was 16. Does that mean that of 16 cases, 9 people have died? That's over 56% mortality. That's the number we should be frightened about. Now, the reality is, I'm sure there was a lot more than 16 people that actually had COVID on March the 11th. And I hope that there was hundreds of people, because that'll just bring my denominator up and it'll change the numbers and it'll make the mortality come down. But currently, with positive cases using that formula, we're actually looking in Florida like a 56% mortality, not a 2%. Let that number sink in. The other thing I want to mention is the first person in China who reported on this was Dr. Li Wen Liang, and I'm probably pronouncing his name wrong, and we all should probably consider him a hero. He was an ophthalmologist, and he was the one who discovered and realized, you know how that doctor got the COVID? It wasn't from being in the emergency room. He was an ophthalmologist. He caught it from taking care of one of his glaucoma patients who came in for a routine appointment. So the point is, at some point, we are going to have to go out and we're going to have to see our doctors. We're going to have to get medicines. We're going to have to update our groceries or whatever. We're going to come into contact with people who have no symptoms. We all have to protect ourselves, especially in a healthcare setting. I strongly advise everyone who works in a hospital, I don't care what level of personnel you are, you should be wearing PPE, full PPE, including eye, hat, mask, everything. We just need to get enough stuff and supplies. Now, there are some websites that are putting medical practitioners together with those in need. If you guys are in centers, my medical and dental friends, if you're in centers where you're considered essential and you have to go to work and you don't think you have the PPE you need, please contact me. Do it through Messenger, text me, email me, and I will try to help connect you with other people who are doing it. We have a 3D printer. Starting Monday, we're going to be printing parts for ventilators. We're already trying to figure out how to do some ways of trying to create some PPE that maybe isn't necessarily 100% approved and all that, but something's better than nothing. So reach out to each other, reach out to me, and let's connect. There's a lot of great Facebook groups specifically for COVID healthcare practitioners. Let me know if you're interested and I'll add you to those groups. There's a ton of great information and networking going on, and that's really the part of this that has been so great to see. So many people are coming together, working together to try to help each other, and I'm just so thrilled to see that. The other thing is reaching out to legislators. I was on the Senator Scott's town hall meeting yesterday, and I heard some great stuff come out of that town hall meeting. I also heard a lot of stuff that was a little concerning. There are a lot of people in high places that I don't think are being careful enough. I'm looking at these and I see people standing next to each other and they're wiping their noses and they're touching the podium. I mean, really? Even in those settings, they should be practicing what they preach. People, stand 6 feet apart, wear a mask, don't touch your face. Anyway, I just think that we all need to be diligent and be careful. Okay, questions. Let me see. There was a couple of questions that came up on my live stream. Let me answer some of those questions. Someone asked me, what about your shoes? Great question. When I come in, the safest thing to do is just take off your shoes, let your shoes just stay outside, and let them decontaminate that way naturally. Or, of course, you can wash them. You can spray them. At the office, my office is open for emergency visits and for post-surgical visits. So we're taking and we're spraying with Lysol and whatnot everybody's shoes that come in the office. We're also taking temperatures every day and keeping 6 feet distances between ourselves and everyone else. So, yes, shoes are very important, great way to bring the virus along. Let me see if there's any other questions. Hello, Tara. I see a big hello for you. Hello, Dr. Rushing. Hello, Dr. Baines. Hello, everyone that's watching. I appreciate you very much. I don't think I see any other live questions happening. What do you think? Russell? My husband's sitting next to me.
Well, I don't think it's appropriate now to go into anything else other than what you've covered. I think we should wait for for the situation to grow a little bit. So I don't really
Can you
have
answer
anything.
a question for me? How do you feel has been the response in terms of like police and law enforcement? What do you see as their role in this situation?
Well, obviously, I'm not as plugged in as I used to be, and now that I'm retired, I have been talking to a few people from Homeland Security in Tampa. I have to say that personally, I don't think they're getting much information, and I don't think that on a tactical level, they are preparing as much as they should. We prepared much more for taking a flight to Haiti during the earthquake weeks prior to leaving than they're doing right now. And I'm specifically talking about their rapid response team and their special SRT team. As far as what the police are doing, I don't know yet. I haven't tapped into that. I do have concerns, though, that they will easily be overwhelmed as hospitals become extremely full and bed space is not available. That's all I have for now.
Okay. Oops. I dropped the phone. So a couple more questions. Amanda, how does this end? It's a really good question. I think that, we're going to get through this. I think that most of us are going to be just fine with a lot of inconveniences. I do think this is going to affect our economy for a while. But there's a lot of ways that the economy can get revved up through this too. I'm hoping that people who have the ability to create and manufacture some PPE can immediately start selling that. We're going to be doing more drive-through business. I think that online and telemedicine visits is now a thing. I'm certainly doing it in my practice. I've been doing it since the COVID, and there's a lot of kinks that need to get worked out, but I'm starting to get a little bit more efficient. Obviously, I can't touch the patients, but there's a lot I can still do and communicate and give advice via doctor visits remotely. So I think that will stay and become a permanent part of my practice. I think that will change for most physicians. I also think that the numbers are going to go up drastically and stabilize and then eventually come down. The thing that does worry me a little bit, from my understanding of how China was able to finally get this under control, they literally went, if you can believe what the news reports are saying, but they literally went in and tested everyone and tested every household and removed family members from houses that were positive. So, for example, someone shows up to your door, tests everyone in the family. If one person's positive, that person gets removed and placed in a temporary housing unit. And then that person has to stay there with other COVID positive people so as not to infect the rest of their families. Once they started really attacking this in a way that they were assessing the asymptomatic people, that's when their curves started to come down. And they were eventually able to close their temporary hospital units, which is fantastic. But if that has to happen here, I'm frightened. Did you want to make a comment?
I'm sorry, folks. I wasn't really prepared to participate in this. I may put something out later regarding safety and security. I will say I've worked for about 5 different government agencies, 25 years in the federal government as a special agent. So I've seen a good amount of things. I've been to many national disasters, so I see how people act in these situations. I also have an understanding for how the government reacts and how prepared or unprepared they are. I think it's pretty clear that we've been caught off guard from a government point of view on this. We weren't prepared for this. I think that our government is doing an excellent job, and I really think that some of the politics are being put aside, which is great. But you have to think about these things. This is the real thing. So now is the time to be thinking about, what haven't I thought about? What have I missed? What can I do now that I might not be able to do later to protect my family? Okay? You have to be thinking 10 steps, and this is how I think. This is how I do things, and it drives me crazy. It's a lot easier to think of one thing and keep things in a perspective box so that you can emotionally handle it. It's a lot more difficult to think of worst case scenario and constantly drain your mind to think 10 steps ahead. But unfortunately, that's what you have to do. Even if you do get it, you're probably going to survive it. However, there could be logistical problems such as getting health care, or let's say something else happens. Let's say you break your arm, and now you're faced with the decision of going to a hospital where you are more susceptible to contracting the virus at a hospital. There's so many different things to think about, and that's why we all need to be talking back and forth, and you need to look to people who have experience in different areas to get their opinion. I have set up a little bit of a think tank on Zoom where I'm pulling different people in, and I'm running anything that goes through my head, I'm running it through their heads so that I am not stuck in my thinking and letting other people analyze what I'm thinking. You should be doing the same. I have been hammering Pat about this information for 2 weeks now, and she has become extremely vigilant. I know how good she is, so I know that her information is sound. She also is not a person to overreact to things. So I think she's looking at this quite objectively. I think you're going to be continuing to put out more information.
I am. You know, one other piece of information that I wrote down, I wanted to make sure that I mentioned. In 24 hours, we have had hold on, let me quote this properly. In 24 hours, we had an increase in the number of COVID cases in Florida by 32%. In the United States, 51%. This isn't going away anytime soon. This is the beginning. We're gonna be seeing the numbers exponentially grow over the next several days, and probably in about a week, we're all going to be under some form of quarantine unless you are absolutely essential workers. So think about that, and think about what you need to do now to prepare if you haven't already. It's not just a convenient socially isolate to protect others. You're going to be into a mandatory quarantine situation. That's how I'm living. That's how we should all be thinking. I've got a few more questions coming up. Let me see if I can answer. Stephanie, how do I think it will change my practice in the future? Well, I think I mentioned a little bit. I think I'm going to keep the telemedicine going. I see that as being very useful, especially for maybe kids who are multiple disability kids. Man, people were so appreciative that I was still able to see their kids, and they didn't have to, the wheelchair and the IVs and the oxygen and all that stuff. I mean, those kids are difficult to get to their appointments anyway, and to be able to do this. Now, we always had telemedicine, or we've always done video chats, but not to the degree I'm doing it now, and I really like it for a lot of things. So I see that as being a permanent fixture in my practice. Let me look at some other questions. Tara, you asked, I know you have a number of children of different races. Can you speak to the xenophobic climate? Oh, Tara, I wish I could understand it. I think that whenever situations happen, there is a lot of opportunity for negativity, but I just don't have time for that in my life. I think that we should be positive. I think that this is not a disease of the Chinese. I mean, that's just not how we should be looking at this. This is a disease of all of us. It does not have boundaries in terms of race, religion, or anything. We're in this together as the human race, and we need to protect each other. We need to protect our elders, and everything that we are doing now will help all of us in the future. So this is not a time to be selfish. This is a time to be helpful and reach out to others. And I really hope that stuff stays away from the discussion. But thanks for bringing it up. Another question, any thoughts about the long-term impacts regarding medically and social impacts? Yeah, I think this is going to scar us for a very long time, but hopefully once we get through the big wave and we can get onto the downturn of the curve, we can resume our activities, and I think we will. In China, it was about 3 months, and they started to resume socialization and whatnot. So if we can get on top of this, and our number curves are going